Come up line in front, please. So, can you just grab my face cushion now, please? Lift your head up, please. And rest your head, is that okay? Yeah. So, come down. Yeah. Okay, let me have a look at this area here. What do you reckon? What do you reckon? Flat? Neutral? Extended? Flexed? What do you want to say?
It's pretty neutral. Maybe a little bit flat.
Okay. If you find L5, yeah, so if you find L5 and then bring your heel, yeah, so the pisiform area. So remember, we find a PSIS S2, yeah, come onto the L5 and have a go at spring in L5. Okay, there is actually a bit of spring on L5, even though the lumbar spine looks more into an extended position rather than looks into a lordotic position. Okay, so let's just leave that alone for a second. So we're going to come on to the PSIS, and with the PSIS, bring your thumbs. What we're going to do is PSIS, yeah, and then bring your thumbs medially and superiorly and come down. Okay, in that sort of area just there. Okay, so as I come down on that, what do you look at my thumbs? What do you see?
The left thumb looks deeper.
So the left thumb looks potentially deeper there. Yeah. So if the left thumb is deeper on that sulcus, it tells me that the sacrum has
Left and left.
rotated right. Yeah, so it's rotated right on the right axis. So the left side is deeper. Okay. I'm not saying it's much better, but it's a little bit deeper on that side. And it was positive on the left. So we're saying that the left side has gone nutated, so it is rotated right on the right oblique axis. So it's right on right sacral torsion.
I can actually see that from here.
Yeah. Okay.
This side looks flatter than that side.
Yeah. Okay, cool. So what we're going to try and do now, we're going to use the piriformis. So we're going to put the patient into a SIMS position. So what we're going to try to do with this one, Susan, I know you have, if I just swap places with you, yeah, because I can guide you into it, but basically you're going to put yourself in this position there, but your legs are going to be there, but you're still going to be in that sort of position there.
Okay.
Yeah, but the legs are going to be up, and you're going to be there, like so. So that could be one way of doing that. Yeah, I can guide my patient, but at least my patient knows which way to do, or to adopt anyway. That's it. Right.
So this is for torsion, or this is for extension?
I'll show you.
Okay.
So bring the legs up. So I'm going to bring them to me. And I'm going to hold on to their knees there. UK in that position there. Right, if you notice, right, the lumbar spine is more what? Flexed or extended?
Extended.
Flexed. Okay, so when you're looking at, find the PSIS, think about what you're trying to do, okay? So the sacrum is rotated to the right and is nutated. So the goal will be to try to get the left nutation back into counter-nutation. So I want to try to counter-nutate the left. I want to try to counter-nutate the left by using part of the lumbar spine. So if I get the flexion into the lumbar, the flexion of the lumbar is trying to do what to the sacrum?
Extension.
Extension, okay, so counter-nutation. So flexion of the lumbar will assist in counter-nutation of the sacrum. So what we're going to do now is we're going to use, so the piriformis, so we're going to use the left piriformis in this case. So from this position, I'm going to find the PSIS. I'm going to bring my fingers medial onto the sacral sulcus in that position there. And Susan, what I'd like you to do is your top foot push up into my hand. Push up into my hand. So she's pushing up into my hand there for 10 seconds. And relax. And then what I'm going to do, I'm just going to bring the legs down. Can you see that? So I'm going to use this piriformis to pull the sacrum back into its neutral position. So I'm going to feel for bind there. Okay, and then push up again. Is that okay for you?
Yeah.
Yeah.
The piriformis is pulling
the left sacrum back into a neutral position.
Okay.
So from nutation, I'm going to use it to bring it to counter-nutate. Relax. Okay, and then a bit further down. Good. Okay, so it's an MET, muscle energy technique. So push up again, you can just see it tapping. And relax, take a breath. And as she breathes out, I'm just going to just take to the third and final position so I can feel for the movement. So I'm trying to feel the sacrum to come into my fingers here. Just relax there for a second. Okay, any hip pathology sometimes will restrict the movement, you know, interlexional rotation. Once I've done that, I'm going to bring my patient back. Yep, and then we can then retest the position now. Okay, good.